Mental health is a topic that affects all of us. It touches our patients, families, communities, and our fellow caregivers. Today, we will hear the courageous story of one of our colleagues. We will also learn about resources to support you. I am joined here today by Crystal Hollins, Patient Service Specialist, and Dr. Amy Friedling, Director of the Caring for Caregivers program, and Dr. Leo Pozuelo, Center Director for Adult Behavioral Health. Thank you all for participating today. Crystal, you reached out to us because you are passionate about this topic. I know you want to share your story with our fellow caregivers. Can you please tell us about your experience?
Yes, thank you. I had a traumatic event right before my birthday, and I just really couldn't deal with the emotions. I felt a lot of sadness. I shared it with my mom, kind of told her, that I was at the edge and I really couldn't handle or understand what I was going through. So she took me to Marymount, and unbeknownst to me, they had psychiatric care that was afforded to me. I met every day with different professionals, different coaches to help me understand what I was going through.
Well, Crystal, I'm so grateful that you want to bring attention to mental health. So first and foremost, how are you doing today? Do you feel supported?
I do, thank you. I am in a much better place. I felt so supported. They really helped me in so many different ways. Like I remember at one point thinking like, oh, I'm gonna lose my job because, I'm fairly new, and, or oh, if my job finds out about, me being out because of what happened to me and not being able to handle my emotions, that I would be embarrassed or it could cost me my job. But they printed out the FMLA paperwork for me. And so they made me aware that my job supports me in every way. I didn't want to reach out for help and I didn't understand, but the care team made sure that I understood everything, and the treatments that they provided for me, I was well receptive of them.
Now I'm going to turn things over to Amy. We know there are perceptions of stigma surrounding mental health. What are some reasons people do not seek help, and why is it so important to get help quickly?
I think a lot of people don't understand that mental health concerns are more common than you may think. There's fear, misunderstanding of what treatment may look like, what counseling services may look like. It's really important to not let shame or fear get in the way, to understand that resources are there to help and support and get you back on track as soon as possible. And it's really a sign of strength to use those resources at your earliest opportunity.
Now we're going to turn things to Leo. You have been studying this topic throughout the entire pandemic. What have you learned about the current state of mental health?
A couple of things, Kelly. The rates of anxiety and depressive disorders in the general population has really increased, even among our caregivers. It can be really scary experiencing these symptoms for the first time. The pandemic can exacerbate previous existing anxiety and depressive symptoms. So you got to be really vigilant about that as they occur and get the help that's needed. And finally, as caregivers, super important to make sure that we're in good emotional shape to be able to take care of others. So it's so important, Crystal, what you have taught us today.
Amy, what are you seeing from our own caregivers? Would you speak about the resources that we have to support them?
Our own caregivers are showing a lot of the same things we see across the population: sadness, fatigue, anxiety, and sometimes difficulties coping, maybe even turning to a little more alcohol or food to cope. There is support available through the Caring for Caregivers team. We offer free, confidential support, whether it be assessment, counseling, coaching, other types of support services, both within our organization and external as well, to maximize health and well-being.
Leo, as the world reopens and people readjust, what can we do to support our mental health on a daily basis?
We know the psychological footprint of this pandemic is going to be huge. It's very important to be in tune to how you're feeling. It's important to inquire how your colleagues are doing and making the time to listen. It's all it takes to validate the emotions and supporting each other. It's really a perfect time to visit your physical health. We know that emotional wellness is tied into physical wellness. Get a physical exam, resume your fitness goals and achieve them. And finally, cherish the moments we have together. This pandemic has had a silver lining in making us appreciate the little but significant things in life, as well as appreciating each other a bit more.
That's sound advice. Thank you, Leo. Crystal, I want to give you the final word. What would you like to say to our caregivers who are watching today?
I remember thinking, my job did this for me. This is the only employer that I've worked for that supported me in this capacity. So it's just very important for everyone to know that the Cleveland Clinic stands behind us. They support us, and everything I experienced was very positive. They really care. And it's really important that if you're feeling sad, you're feeling overwhelmed, Cleveland Clinic has so many programs to support and to help us. So please take advantage of it.
Thank you, Crystal. I appreciate each of you for having this important discussion. It is a brave and noble thing to do. Thank you very much. As caregivers, our lives and careers are emotional and complex. If you ever feel like you need help, please reach out to our teams and get support. We will never assign stigma to any health issue. We are here to take care of patients and caregivers and help them heal. Thank you for caring about each other like a family.